By Shy Diesel in Effingham on 97.9 XFM.
Good afternoon, everybody. 4:30, I do believe, or make it 4:32. We were learning a little. It took us a while to get us winner there, Brian.
Close enough. That was a good contest.
It was tough indeed, but it didn't take as long to get a winner in here. Now we got Caitlin Sudkamp here from St. Anthony Memorial Hospital.
Hi, Caitlin.
Hi.
Got a little purple shirt on there with HSHS, and
yeah.
Is a purple shirt for any reason, or is that what you wear to work?
Because it's really comfortable, and I wear it to work.
Okay, very good.
Works for me.
So you've been working all day?
No, actually today was my day off.
But she just dressed up to come in.
Just to come in here, yeah.
Well, listen, man, you're dedicated.
That impresses us.
And that is A-okay. Thanks. I wore a black shirt today. Which I wear almost every day.
Yeah, I was going to say.
Sometimes with a rock band on it, sometimes with nothing on it. So I got that.
All good.
But you're here to talk about something specific. Astym?
Astym, yes.
Astym. Tell a little bit about it because we don't know anything.
Yeah.
So Astym, so what it is, it's a type of soft tissue mobilization. It's a type of treatment where we use instruments to help break up excess scar tissue in the body. So scar tissue, there's a natural pattern of it over your entire body. But whenever you have trouble with pain or you have surgery or some sort of precursor, the body will lay an excess of that down over the area. So what we do with this is we take these instruments and glide them parallel to muscle fibers, and it breaks down the scar tissue in the body. So it's really cool. It's really effective. A lot of people will get pain relief right away with it.
I can see that.
Yes, yeah.
Okay, so you got scar tissue from what exactly?
Yeah.
What do people usually get the scar tissue from?
So there's a lot of different things, but usually the most common are after having surgery, even just like any sort of injury. So, you could walk out and sprain your ankle and get scar tissue built up in there.
Twisting it. I probably got some in my knee from a baseball injury I
do.
had back in the day. And it was like, whatever.
Yes,
so, but I just live with it. But I don't have to live with it, don't I?
Exactly. You don't have to live with it. We can help break up that scar tissue. We can get people moving a lot quicker. We can kind of get people back out to doing their normal activities without a lot of pain.
It's very interesting.
So is it something that actually changes something inside your body? You say break it up. It's not just like a medication, like a pain relief type of thing. It's like a permanent change.
Correct, yeah. So usually I tell patients the more compliant that they are with what we tell them, the better the results. But what it does, whenever it breaks up that scar tissue, your body reabsorbs that. So we give specific tailored exercises and stretching to help prevent that to lay back down in an orderly or into that disorganization. So we give those exercises to kind of help prevent that from laying back down like that.
She brought a couple of instruments there. We're not on Facebook. This would have been a good one to be on Facebook Live today.
Yep, I brought them in. Just
what is that? That's like a shark fin.
I know. That's kind of what it looks like. They're kind of scary looking.
Or ice skates upside down.
Yeah, it's just made of polymer plastic. There's nothing really too special about it. But yeah, it's got a very small surface area. So people that are having lots of pain can actually tolerate this really well just because of there's not really much surface area with it at all. So people that have trouble with like our hands being placed on them, we can use this and they can tolerate it a lot better.
Well, that's interesting.
Yeah, that's pretty neat.
That is pretty good. What's this other thing you got there?
Yes, this is just
I don't want to know what that
you have no idea.
What is that? That's
no idea.
You have no idea how many comments we get. It would be a good Facebook Live one because nobody can see what we're talking about.
Well, the things I can say right now, and I want to, but I'm not going to because I love my job. Okay, very good.
Yeah.
All right.
But what do you use that for?
So it's just it's done in a very specific pattern. So what's really nice about this is we have 13 different therapists that can perform this treatment. So it doesn't matter which of the 13 therapists that you have. We're all going to do it exactly the same because we do it with the same exact instruments. So yeah, they're all. It's a very specific thing that we use these for.
It's called Astym.
Astym.
Astym. ASTYM in case you're wanting to look it up online or something like that.
Yep, there is
Pretty
a
cool.
website for it. Yeah, astym.com. It's got a ton of information. There's tons of research on it too as well. So yeah, there's just a wealth of knowledge that's on their website.
All right, you was wanting to talk about pregnant and postpartum. Is it safe for those ladies?
Yeah, so it's a great question because a lot of times women are told what they can't do while they're pregnant or postpartum. This is actually safe and effective most of the time while pregnant or postpartum. Pretty much the only contraindications are if they're on a blood thinner, but most of the time pregnant women aren't. So it's a really safe, effective way to help with pain, to help people get moving just a little bit more while they're pregnant and postpartum. Yeah.
It's very Does it hurt much when you do this to people? Or can it at times?
So it can. Usually I tell people the first treatment can be the most tender. If you think about somebody coming in with 8 out of 10 pain, it can be tender to have somebody...
I would think so.
Exactly. Yeah. So it can be tender. But after that, usually people kind of get hooked with it and they want to keep coming back to have the Astym done because of how good that it makes them feel afterwards. It takes that pain level down.
No pain, no gain.
No pain, no gain, yes, in this case.
I mean, if you're all hosed up like that and you can't get around
right.
anything, you'll put up with a little bit of pressure and a little bit of pain
to
be able to walk halfway normal or something again.
Relief.
Relief, yes.
Give me some relief.
Yes,
and
absolutely.
How long, I mean, you're talking about like a session or I don't know what you call it, a treatment. Does that take a while or is it quick or it just depends on the situation?
It depends on the situation, but so somebody could come in for one visit. We have a cash pay system, so somebody could come in ultimately for one visit, be seen by Astym for a quick tune-up, and then be out the door. Most patients that we see, it's anywhere from 4 visits to 8 visits. But yeah, diagnosis, everything's, a little bit different with it. So it just kind of depends on what they're coming in for, how much pain they're in too, and how long they've been in pain for. If they're coming in 15 years of pain, it might take a while to get the pain back.
I would think so.
It's out there, though.
Yeah, it just depends on, the diagnosis usually when we see patients.
Where'd you guys learn how to do this? Kind of curious.
I actually learned about 10 years ago up in Chicago with my first job. I worked at a clinic and they got us all certified. It was a weekend-long, grueling course of you get this done on you. You
get the experience.
Yes, you get the experience. So you treat everybody else. Everybody treats you, so you know how it feels whenever you do it. So, it's a pretty rough course, but it's definitely worth it for patients. We get great outcomes with it.
Sounds great. Sounds like something that some people, specific people, could probably really help themselves out quite a bit with this.
We use it on so many different patients. I mean, I don't have a number exactly, but I would say at least 80% of our patients get this.
Oh, wow.
Yeah, we get a lot of patients that will benefit from it.
Obviously, it's something good.
Yes.
And that is really cool stuff.
Yes.
How long have they been doing stuff like that? Any idea over the years?
Oh, gosh, it's been going on for a long, long time. It was actually based off of the ancient Chinese cupping and spooning way back in the day. So it was, it's been going on for a long, long time. We've just kind of modernized it a little bit. It was developed out at Ball State University.
Really?
So it's just been modernized, and now we have these fancy tools.
Ball State, the home of David Letterman.
That's right. Indiana.
Yeah.
Very good.
They're geniuses.
Insurance-wise, will this insurance cover this?
As long as your insurance covers physical and occupational therapy, yes, it will be covered.
Right.
We don't have any trouble with that. So people can get an order and come in to see us, or like I said, we have a cash pay program too as well. So people could literally walk in off the street without a doctor's order, and we can get you right in wherever we have an availability at.
All right. Well, how do we get an appointment? Like, say, you can go through your doctor and do that. Or is there a place you can call for more information about this?
Sure. You can always call our office. Our number is 217 347-1243. You can speak with the front office, or you can speak with any of us therapists as well, and we'll be happy to answer any questions.
And where do you do this service at?
So we do this at the Workman Sports Complex. All of it's done there. So regardless of whether it's a one-time treatment or it's multiple different treatments, we do all of our therapy there.
Oh, you can get this done, then go swimming. It'll be
great.
Yeah,
exactly. I just do that afterwards.
Doesn't sound bad, actually.
I think it'd be a nice feeling, indeed. Well, it sounds great, Caitlin, and thank you much for bringing your stuff there.
Thanks for having me.
I kind of know what you got going on there, and that's pretty cool.
Yes.
Very good. All right. Well, thank you much for coming in, and we'll talk to you again real soon, okay?
Yep, thank you.
All right. Well, Brian Dusser, are you hurting any right now?
No, but I'm thinking I'm going to turn something about the name Astym into our drive time trivia question.
Oh, that'll be awesome. Be on the lookout for that. All right.
Maybe.
Talk to you in a bit.
Classic bands.